Hello, my name is Kristyn. I'm also taking the class for One Health, One Medicine, and for the seminar presentation, I chose to do Zika virus. I know we've talked a lot about it in the class, however, I had my own hands-on experience with Zika virus this past summer when I went to do a global medical project in Brazil during the time of the Summer Olympics. It was an amazing and unique experience, and this is why I chose to explore Zika a little bit more. Some background information on Zika. Zika was first isolated in the rhesus monkey in a forest called Zika Forest in Uganda, Africa, in 1947. This is where the Zika virus got its name from. The first case was found in humans in 1954 in Nigeria, also in Africa, as you can see highlighted on the picture to the right. The latest and largest outbreak of Zika virus was in Brazil and started in 2015, although is still widely occurring throughout the world. It is transmitted to humans by infected mosquitoes, and it is transmitted between humans through blood transfusion, sexual activity, and perinatal transmission, meaning between mother and baby before or just after birth. The signs and symptoms of Zika are usually very mild and include low-grade fever, muscle aches, joint pain, headache, swelling, conjunctivitis, which is inflammation in the eye, and also pain behind the eye, and occasionally a skin rash, although that's less common. The majority of people, 75% of people who are infected with Zika virus are asymptomatic, meaning they show absolutely no signs or symptoms of infection. And because of this, the Zika virus is particularly dangerous because if people do not know they are sick, they often do not take preventative measures and so spread the disease widely and rapidly. Although most side effects are very mild, there are serious but rare side effects and complications with the Zika infection that are life-threatening. These include Guillain-Barré syndrome, which is a disorder in which the individual's immune system begins to attack its nerve. Symptoms usually start out as tingling and weakness in the extremities and eventually lead to total paralysis throughout the body and death. There is no cure for Guillain-Barré syndrome, but there are medications that can prolong an individual's life and reduce their suffering throughout. Another more common serious side effect is microcephaly, and this is a birth defect in which the head and brain are smaller than expected and are underdeveloped. Infants born with microcephaly experience a wide range of problems throughout their life, including seizures, mental retardation, of which the severity of the retardation depends on the severity of the microcephaly and how small the brain is, developmental delay, intellectual disability, learning disabilities, problem with movement and balance, hearing, and vision loss. Diagnosis of Zika infection can be done in a few ways. By isolating viral and nucleic acid, virus isolation, so actually isolating the virus from the blood, serological testing, including anti-Zika IgM and IgG antibodies, and urine and saliva samples taken within the first 3 to 5 days after symptom onset are considered a reliable diagnosis tool. There is no treatment currently for the Zika virus. However, we do manage symptoms using analgesics and antipyretics. Analgesics are used to reduce pain, and antipyretics are used to reduce fever that is often associated with Zika infection. So the disease burden and a critical analysis of the Zika virus infection. So here I'll be focusing mainly on Brazil, but this does apply to all of the South American countries and the southern countries that have been affected, including the Caribbean, and also it is now beginning to apply to the States and the UK and Europe, where we're actually seeing more cases. So, without a vaccine, clinicians can offer women of childbearing age little protection beyond advice to avoid mosquito bites, delay pregnancy, or refrain from travel to areas with active transmission of the Zika virus. Few countries in the outbreak zone, so this is mainly I'm referring to Brazil, South America, Latin America, the Caribbean, have universal access to sexual and family planning services. So in the Caribbean and Latin American countries where Zika infection rates are very high, it is estimated that 56% of all births are unintended. So for these individuals, they are at particularly high risk of transmitting the infection to their child. They're not intending to have children. A lot of the people around them are not showing symptoms. They do end up unintentionally getting pregnant. They're not protecting themselves against the virus because the most severe effects usually and most often occur in babies with the microcephaly, although Guillain-Barré syndrome can exist in adults. So in these countries, the majority of women having the babies are young, poor, and ill-equipped to take care of them. The mothers in the countries most affected by Zika cannot afford to take care of the children with microcephaly and afford the special care it takes. In a rich country like the US, it's estimated that the cost of caring for a child with microencephaly is 10 million US dollars, which is almost unaffordable to the average person in a wealthy country, let alone a person in a very poor country. In a poor country like Brazil, mothers often are left to care for the babies by themselves. They have to give up work, and they're also finding it impossible to access support from health and social services. So the disease burden falls on the poorest of people for many reasons, such as the lack of sanitation and running water, forcing them to store their water in containers, which are ideal breeding grounds for these mosquitoes. And additionally, these people cannot afford air conditioning, insect screen, or repellent, and so it is almost impossible to protect themselves from the infection. Additionally, what I found when I went to Brazil and went into these poor places called the favelas is that a lot of people didn't really understand how the disease was transmitted other than through mosquitoes. They didn't understand it was also through sex and from mother to child. And so for our current and future initiatives, so current strategies focus on the treatment of symptoms in emergent situations, so when there is an outbreak, and trying to provide and support individuals and families and communities who are in emergent situations and seek help. So this is a very unsustainable initiative because it's not sustainable for the future generations. It's not going to help prevent the disease. So, although we do need to continue providing these people with support and treating symptoms in emergent cases, we also need to implement sustainable strategies. And these strategies include source reduction, community engagement, education, surveillance, and detection. So we must continue current strategies while focusing on educating the communities to encourage community engagement in source reduction. So for education, because Zika is relatively easy to stop the spread of the disease and prevent it with basic knowledge, education is going to be most likely one of the easiest and most cost-effective tools to preventing the spread of the virus. We can send local health officials into neighborhoods to educate people on transmission and prevention, and teaching them about the disposing of stagnant water sources, the covering of their water containers, the use of protective clothing, insecticide, and time periods after infection for reproduction. So we need to also educate people on safety timelines after suspected infection for the Zika virus, because if they are infected, don't have resources to help, resources, for the treatment of their symptoms, or do have the resources but want to stop the infection at them, stop the spread of the infection at them, there are some guidelines. These include, in regions with no active transmission, the World Health Organization recommends practicing safe sex or abstinence for a period of 6 months for men and women who are returning from areas of active transmission. Sexual partners of pregnant women living in or returning from areas where transmission is active should practice safe sex or abstain from sexual activity for the duration of their pregnancy. And source reduction. So the best way to reduce sources is through community engagement. So although we can send health officials to dump out all of the water sources and empty ponds and stuff, the best thing we can do is the people who live there know where they're getting in contact with the most stagnant water. So the best thing we can do is try to get them involved in reducing the number of natural and artificial water habitats, So get people to cover their water storage container, to dump out the sink water when they're not using it, etc., and to use barriers such as screens, protective clothing, and repellent. And we'd also like to increase the surveillance. So instead of waiting for an outbreak to happen, we'd like to monitor it before it becomes an emergent situation, and we'd like to detect it earlier so that we can stop its spreading earlier. So, thank you very much for listening to my presentation.